break to come and join us in this session where we're talking about common ailments and how to manage those at home and becoming more self-aware. So this is a webinar produced by the Self-Care Forum. So welcome to everybody. So just to introduce me, and I'll introduce my colleagues as we go on as well. So I'm Helen Donovan. I'm a registered nurse and I'm the chair of the Self-Care Forum. I work independently as a nurse consultant. So we are going to talk about the Self-Care Forum first, give you a little bit of a background about it, but I'll come on to the whole process of the webinar. So Laura's already said a few of the housekeeping, so please do keep your lines muted. It's amazing how many extraneous noises can come through. So please do mute your line, but if you want to speak at the end, we will have an opportunity so you can come off of mute towards the end. But please do use the chat function to ask questions because we will come to those as well. Now, this webinar is about supporting and improving people's knowledge about self-care. And we want to make it really clear that we won't be able to answer specific questions about patients or about family members, sort of health related. We want to keep it general about self-care. We are going to be recording this webinar, as Laura has said, so please do keep yourselves off camera. If you are having any technical problems, do use the message function or email. And finally, really important, we want your feedback. So please do also use the evaluation link that Libby will be sending at the end. So please don't forget that. So what we're going to talk about today is, first of all, understand what is meant by self-care, hopefully give you some appreciation of why self-care is important to the wider health and care system, be able to identify some of the symptoms that are associated with common ailments and how long they might normally last, know when and where to seek professional health advice, and finally consider what makes us adopt certain health behaviours. So
Helen, could I just check? Sorry,
Mm-hmm.
I can't see the slides. I don't know if it's just me. Can anyone else? No, we haven't got slides up as yet, Helen.
Oh, sorry about that.
It's okay. It was lovely to see you while you were doing your introduction. There we go.
Sorry about that, colleagues. I don't think you missed anything particularly wonderful, but we'll come back to all of the information. But so my name, Helen Donovan, and I've also got colleagues with me, Addie Williams, who's a pharmacist in Bristol area. I've got Pete Smith, who's the president of the Self-Care Forum, and he's a GP by background. Also Trevor Gore, who's another pharmacist by background. And then we've got time at the end for questions and answers, which is obviously over to you. So what I thought we would just start with was just to tell you a little bit about the Self-Care Forum. So we're a UK-wide charity and really a coalition of stakeholders from all sorts of professional, patient and industry groups. Our aim is to further the reach of self-care and embed it into everybody's personal and professional lives. So we do this by having a practical, pragmatic approach. We provide free resources that are all evidence-based, and we want to raise awareness of self-care, and that is our link on this slide at the bottom there. So the Self-Care Forum developed this self-care continuum because what we really want to try and get over is that self-care is a continuous process, from those daily choices that we make about what we eat, even whether we brush our teeth twice a day, to how we live and how we sort of think about any illnesses that we've got and how we manage those, through to sort of managing long-term conditions, to how we cope after major trauma and how we can support people to work with that. So it's the actions that individuals take for themselves, that might be on behalf of or with others, in order to develop, protect, maintain and improve their overall health and well-being or wellness. We're very keen to make sure that people don't think that self-care means no care. It absolutely doesn't. This is support for healthcare professionals to help promote self-care, but also support for the wider public in looking after themselves. So we have key areas of work. We're coming up to Self-Care Week, which happens always in the middle of November. We produce a whole array of fact sheets, which we will be coming to. We've also supported in terms of self-care aware consultations and some e-learning resources that are available on e-learning for health. And we have wide collaborations with national influencers in order to try and get this message across. Continuing awareness, raising, targeting that message to frontline healthcare professionals is our core work. And we also have our Self-Care Innovation Awards. So we will be announcing the winners of this year's awards at the beginning of Self-Care Week, which is just coming up. And those are all published on our website. So just very quickly, what the research is telling us and how this informs the work that we do at the Self-Care Forum. So I mentioned the continuum before, and no, my slide hasn't slipped. This is very deliberately put like this because actually the reality is that most care falls at this end. We're nowhere near having the continuum that we want. And indeed, some of the evidence suggests that out of 10 hours of professional contact, an individual will have 8,750 hours of self-care. So one of the messages might be that if you want to be proud and support the NHS, which of course we all do, you need to love yourself first and how you can look after yourself. So understanding what we all do, which is when we find what we want to look up something, we tend to go to the internet. So Google search results actually tell us quite a bit about how much people are looking for self-care information. And back in 2017, it was just over 300 million clicks for self-care. 2022 is 3,280 million, 2022 5,000 million, and this year the latest one over 6.2 million Google searches for self-care. So it does indicate that people are wanting to find out for themselves. And indeed, this is research that goes right back to 2011 and looking at what we see in terms of healthcare professionals, whether GP, nurses, other colleagues in primary care, to what the patient's actually experiencing is only literally the tip of the iceberg. So people do look at information on the internet, they talk to friends, but by and large, they ignore things. So how can we better inform people as what they need to take notice of? So we've now got a range of fact sheets. Actually, there's 26 because we're going to introduce 2 more fact sheets. So 24 up until now. We've got 2 more come online, and they range from a whole range of different things. We've got the one before the ones we've just published was on the menopause. We've got a general one on the power of self-care, which is very well used, and things like sore throat, common cold, lower back pain. And we know from looking at how many times these are accessed that they are used very, very widely. So 245.57 thousand backlinks, which is a huge amount. So people are using them and finding them valuable. These are the 2 new fact sheets that my colleagues are going to talk about in a minute. We've got one on winter wellness and one on winter illness. These have been also translated into Urdu alongside 8 other of the fact sheets. So we've now got 10 fact sheets that have been translated into Urdu. So that's all I wanted to say. I'm going to pass on to my colleague Adi. So over to you, Adi.
Thank you so much, Helen, and thanks everybody for joining us today. I'm going to be talking about, as Helen mentioned, our hot off the press winter wellness fact sheet, and it is certainly proving to be one of the very popular fact sheets that we have had produced there. Going on to the next slide, it just gives us an insight into the acronym which we've used behind the fact sheet, and it's to really make it relatable and also to help not just ourselves, but more importantly, the people that we share it with, to remember and to be able to use it effectively there. So we've used, get ready, and with the ready particularly breaking it down to give us a sense of to remember to plan, the importance of energy and warmth, the vital role of asking your pharmacy team for support, the essence and the core knowledge actually around diet and nutrition. And when we come to that, you will find some of the essence of how we produce our fact sheets, which bearing in mind that what we're trying to do is really to communicate in a manner that is relatable and accessible. We're not trying to lecture people, but we're trying to empower. And the one on diet and nutrition, especially in this one, really brings that to the fore. And then really that emphasis on the fact that you matter a lot. And it's really kind of stressing that it's not just really looking at just sort of tangible actions and tangible things, but that intrinsic value that involves you, the person, and your mental and psychological safety are really part of the holistic care that the Self-Care Forum always helps to champion there. Thank you very much. So looking into this particular fact sheet, we start off really by trying to draw all our attention to the fact that, the winter will come. And for many of us, it has landed in some country this week, and it's taken us in some sense by surprise, which is why we always say, remember to plan. And it's reminding us that also of the fact that for many of us, apart from the fact that the change in the seasons may take us away from doing some activity and bring a certain amount of maybe discomfort, for a significant portion of the population, as the weather gets colder, it can also mean that their underlying health risk or the underlying health conditions can also make them more vulnerable. So we draw emphasis on who that may be, particularly babies and children under 5, people who live on a low income, and we also expand on that in the fact sheet when we're talking about want, about fuel poverty as well. People with a disability, pregnant women, and people with mental health condition. Not surprisingly, if you look at the NHS England strategy around health inequalities, which is the core 20+5, you will find that lots of the same groups of people that we've just mentioned in our fact sheet are part of those that are at risk of experiencing health inequalities. So these fact sheets as well, apart from just a broad message, it also can help to direct us in terms of how do we help the people that we know and need the help the most. So what are we talking about when we say to remember to plan? Well, the first thing is that we need to make sure we get ready with suitable clothes, and bearing in mind that the best advice is always to layer up for warmth. It also gives practical tips, test and service your heating system as well there, making sure that it's ready. One of the things we suggest to you to do is it may be worth contacting your energy provider. Many of them may offer this service as part of the contract you're already having. It will never be said of the Self-Care Forum that we produce fact sheets that don't help you to access the help that's already available in your gift. Just like Helen mentioned earlier, we know that majority of self-care is what every one of us already does. So as a healthcare professional, it's also about empowering people. So we come into some practical things that may require outside help, sorting out your medicines cabinet, suggesting for people what may be what they should have in there. So core simple things, paracetamol, ibuprofen, the importance of a first aid kit as well, thermometers and plasters. And very importantly, especially this time of the year, the NHS flu and COVID vaccination campaign is up and running, and it invites all the people, actually, or majority of the people that I've just mentioned at the beginning of the slide about that are in the vulnerable group from the cold weather. And the key thing is we know that a significant proportion of that number of people don't turn up. Many of those is not by choice. Some people just forget, and some people don't even know. So it's really, again, to try and look at ourselves and in our practice of when we're planning to look at winter wellness, get your COVID and flu vaccinations so that you don't end up picking up one of those viruses, which of course not only it would kind of have such adverse and unpredictable impact on your health, but then also means that you need to seek help sometimes in the worst thing there. And just the emphasis is on the fact that for this group of people, important to highlight that it's free, and also that there is usually a private flu vaccination access via local community pharmacies as well. So we're going to move on to the next part of the next slide, and this now we're talking now about the E bit of the acronym, which is the energy and warmth. Now, for this one, first thing to say, 18 degrees is that golden norm. So if you live in the household where the conversation is about whether it's too warm or too cold, and then maybe you just need to get a sticker on there to say that the Self-Care Forum endorses the 18% 18 degrees temperature guide for this house, and that could just be, get everybody a compromise to go for. But what we also do, suggesting ways of getting to the 18 degrees without you, as it were, emptying the bank. So we say use hot water bottles, that's important, electric blankets as well, and heated throws to stay warm. And we say that sometimes they're usually cheaper and more environmentally efficient than turning up the thermostat. So it can be said that we've helped to end the thermostat wars in your house as well. Practical tips about staying indoors more than usual, trying to stay as active as possible, getting up and moving around. Important information for every one of us, especially at this time where we just may want to just sit down and, because moving around, getting up, and outside boosts our mood and energy levels. If we do go out, to gain that message of just putting on the layers as well, and not forgetting to get a hat and gloves as well over your head, and you have the license of individual expression with your hats and your gloves that go with that as well. Practical tips in the house about keeping warm and blocking using your curtains effectively, and also key things there about how if energy suppliers, many energy suppliers will provide you information on how to use your heating system more effectively. I come to the bit that I guess as a pharmacist I can't but feel a lot of pride in, is to remind everybody that you can ask your pharmacy team for advice, not just about your medicines or minor or common ailments, but really on a broad range of issues. Why? Because you have highly trained, accessible healthcare professionals, and they're there to advise you and your family and your loved ones over the winter months. Pharmacists' clinical expertise is now being more widely used across the NHS, and that means that there are lots of services that you may not even know you can access in your community pharmacy. Very commonly, to remind people again, vaccination either for COVID and flu, but also there is direct referrals now for common ailments, treating UTIs, a whole range of things in there. So definitely we're speaking into them. Well, when you're looking at that clearing out of your medicines cabinet and discussing, what should go in, or a symptom for yourself or your loved one, again, you have the access of the pharmacy team. So please definitely, make sure you make the most of that there. The next slide, which contains the last 2 points that we got, it really talks about the importance of diet and eating at this particular time. Of course, I haven't had the summer months, and there where maybe you be dining out and eating a whole sort of more seasonal meals. It's important that winter is the time for many people where getting that balance is even more important to help to maintain our health and boost our immune systems. So it's not a time to abandon your 5 portions of fruit and veg. There it's a time to take more regular hot meals and foods such as porridges and soups and stews. There one of the things that we also really try to debunk is the sense that, if it's frozen or if it's a thin fruit or vegetable, it's got little or less value. The key bit we say is you need to look out that it has no added salt or sugar in it. And particularly at a time when we know that the cost of living continues to play a big part on how people access food and how and actually how they're able to look after their family. We stress that many chefs now have information that you can access on recipes that they share as well, some of which are actually even posted online, on using readily available low-cost items to make wholesome meals, including tinned fruits and vegetables as well. And we think that that's the way. We also want to say, really, while appreciating the fact that that the use of food banks are widespread, and for many people they are a lifeline, that we believe that it's important that healthcare professionals, we help to move people away from any sense of shame or stigma with doing this. But because also not only do they provide information, provide food and support, but they also provide information actually about cooking and also help with energy bills. So just to put those things out there, we stress the importance of vitamin D as well. At the winter months, less sunshine, important time for us to make sure that our patients and communities get enough vitamin D, speaking to their GP, community pharmacy counters as well, to get vitamin D supplementation if appropriate for them. And then finally, winter months, and as the darker times that we have and the less social interaction we know can play an impact in terms of how people feel. So what do we say you should do then? We want you to look after your mental well-being. We want you to continue to be part of the community, to get out, to have more social interactions. We want you, if you know that you have historically or are experiencing bouts of low mood, you're feeling increasingly stressed, that rather than simply coping with that on your own, we believe that it's important that we are part of how we destigmatize this, but also send our support. So the fact sheet gives, a real sense of this, explaining why this happens, reminding people that stress, especially because of its impact on the hormones, also makes you more, compromises and can weaken your immune system there. But the importance also of just being active, staying, keeping in touch with friends and family, and also for every one of us, a reminder to reach out to people that we may not be seeing or being in contact with. So thank you for listening to me. The last slide just reminds you that we have, apart from this winter wellness one, which is with the, get ready fact sheet, acronym, we have a whole suite of fact sheets out there that we'll be more than happy for you to access. But also, if you think that you would love to partner with us or find out how you can put your logo or share your interest, we'll be more than happy to do something with you. I'll hand over to Pete Smith, who will no doubt tell you about the wonderful work that we've been doing, to support more evidence-based care as well.
Thanks, Ade and Helen. Good afternoon, everybody. I have to apologise in advance because I actually have a winter illness at the moment. I might start to cough, so we'll wait and see. When we started looking at preparing for winter, we were originally just going to talk about winter wellness, but we felt that despite everyone's best efforts, it's very easy to catch a winter illness. Percentage-wise, we're likely to catch one. So we thought we'd like to give you the full armory of how to deal with anything that winter can throw at you. If we could go on to the next slide. So what we've done, now we know that when people come for information, you're not necessarily sure what illness you've got. So what we've done is to collect some of them together so you can decide for yourself from the brief summaries that we've given, the condition that you might actually have, because it's not always straightforward, is it? Because there are overlapping symptoms. You can get cough with colds, COVID and flu. You can get a temperature with flu, sore throat, COVID, even norovirus. So there's no sort of killer question that allows you to distinguish between these conditions. But we know that it's perfectly possible to give people enough information about illnesses for them to be able to make their own decisions. And of course, change their minds if they feel the initial diagnosis is wrong and they want to change the way they manage something, because it's what doctors do all the time. They gather as much information as they can, and based on that information, they make what they call a working diagnosis, and they can change it if new information emerges. And you can do that. Patients can do that. The public can do that. They're perfectly capable of doing it. And people have been doing this since the year dot. I can guarantee that the first Homo sapiens that caught the first cold 200,000 years ago managed it themselves. They didn't go to a GP, and they certainly didn't ring 111. So historically, we've always dealt with these things. And if you look at the percentage in the iceberg that Helen showed you earlier, or the vast range of different symptoms people can experience, only 8% of people actually end up going to the GP. Most people get the information themselves and they manage it themselves, and usually very well. So what we said consistently is let's not infantilize people. Let's give people the information they need and let them make their own decisions, because they can do that. But also being aware that there is somebody there for you if you need help, if you're not sure.
Can I just briefly interrupt you? I'm so sorry. Could I just remind all guests, if you could keep your cameras off, that would be brilliant.
I'll leave mine on though. We hope you'll download the fact sheets and read them and be informed by them. What I want to do is to just go through a few of the highlights. I'm not going to go through it word for word. First of all, starting off, despite the fact you'd seen the term minor illness before, we don't like the term minor illness. The reality is, if you've got a cold, or particularly if you've got something like flu or norovirus, you feel ill. It doesn't feel minor to you. So we prefer to use the term common illnesses rather than minor, because it does not feel minor. But for each of the illnesses that we cover, there are 4 main questions. What symptoms can I get? How long is it going to last? Which is absolutely crucial. What can I do to help myself? And when should I seek help? And obviously, if you're looking after somebody, then this applies to them. So on the first page, and you'll see there that this is actually the first page of the fact sheet. You'll see these are symptoms rather than conditions or diagnosis. It's cold, sore throat and cough. So starting with a cold, how do you know you've got a cold? You'll have a blocked or runny nose or sneezing, probably coughing and perhaps a bit of a sore throat and a slight fever. But if you have a high fever, it probably isn't a cold, or you have other complications. Now, these symptoms will make you feel rotten. You may feel it's not minor at that type, but managing it may seem obvious, but it's not always. So it is important to rest. It is important to eat healthily and drink plenty of fluids and take paracetamol or ibuprofen to help with the symptoms, because they can do. Now, you should not be exceedingly unwell with a cold, and the symptoms will usually last about 10 days. But if it's going on for 3 weeks or so, you should be seeking help. You'll have heard in the press recently about long colds. But if you're still feeling unwell after about 3 weeks, you should be asking for an opinion, asking for help. So a cold shouldn't make you terribly unwell. But if you have a high temperature and you have another underlying condition or other reasons why your immune system is weakened, you should seek help sooner. And of course, if you have other symptoms that not the standard cold one, then consider asking for help sooner as well. For instance, if you're getting chest pain, coughing up blood, if you have difficulty breathing or swelling in the glands in your armpits or on your neck, then these really suggest it's probably not a cold and you do need to seek help. So moving on to sore throat. Now, you may have a bit of a sore throat with a cold as well, and you can have a sore throat which is purely by itself, which may be a strep throat. We have another fact sheet that deals with that in more detail, but basically, even a strep throat should only last about a week. And generally, it's the same sort of sensible advice. Antibiotics generally are not called for most sore throats. And it's important you drink plenty of water. sucking lozenges can sometimes help, or ice cubes and lollies, or gargling with warm salty water. But obviously these are things you shouldn't get children to do, because they may well run into problems if you do. It's also worth remembering that if you have a sore throat with a cough, it's much less likely to be a strep throat. So whatever the cause, it can last around 7 days. But if you get to 10 to 14 days and you feel unwell, although antibiotics are rarely required, you should actually still be seeking help at that stage. Also, if you have severe problems with swallowing or severe pain, particularly if it comes on quickly and you have a temperature, then you should be asking for advice. So moving on to cough. Coughs are very common. We get them. I've got one at the moment. 1 in 5 people will get a cough during winter, and it's that time of year, isn't it, at the moment? Children will often get several coughs a year, and symptoms can last up to 3 weeks. And it's important to be aware of that. It isn't something, I know there's been sort of tradition, coughs are over in a week. They're not. They can last up to 3 weeks. And in some cases, they can last a lot longer, particularly if you get a thing called a post-viral cough. Some people feel better taking medicine from pharmacies. Others find honey is helpful, but obviously that shouldn't be given to babies. And once again, if you are developing other symptoms, if you're coughing up blood, if you get chest pain or you're breathless, or you've already had, for instance, weight loss prior to that for several months, or you get a hoarse voice, which persists, or changes in your voice that lasts for longer than about 3 weeks, you need to be reviewed by a professional. And also if you get extra lumps and swellings around your neck above your collarbones in particular. Finally, a little bit of a grey area with coughs. The reason we've said here to seek help if you have a cough lasting more than 3 weeks, it particularly applies to adults, because the NHS advice applies, and it is that after 3 weeks, you need to consider other diagnoses. And that one of the diagnoses that's on the list is lung cancer. It's unlikely, but the NHS recommends that you seek a GP opinion if you've got a cough that's lasting more than 3 weeks. If we can go on to the next slide, please. Excuse me. So now we get on to perhaps more potentially serious diagnoses as opposed to just the symptoms, and we start with flu. So how can you tell the difference between cold and flu? Well, there's an old adage that if you're standing at the edge of a field and there's a £20 note in the middle of the field and you feel too unwell to go and pick it up, then it's probably flu. Of course, if you have a cold, you're £20 up on the deal. That used to be £10 that we quote, but because of inflation, it's now up to £20. I'm sure you'll remember, those of you who've had flu, and it's probably everybody, how unwell you feel. You'll often get a temperature of the flu, and you get that awful muscle fatigue and headaches and aches and pains, and usually a dry chesty cough. You can develop phlegm as well if you get further infection. Now, one of the most important things, as I mentioned earlier, is if you are eligible for a flu jab, go and have it, because that's the best way of preventing you from getting it and preventing your loved ones from getting it, because you're not going to pass it on to them. The rule, the sort of the basic advice is the same as before. It is about rest. It is about fluids. It is about taking paracetamol or ibuprofen, not just to bring down your temper, but also to reduce the aches and pains that you can get with flu. And again, you should be taking precaution you don't pass it on. So you can feel awful, but you should be improving after about 7 days. So if you're worried and you have flu, or if you have a child, particularly if they're under 2, or if you're over 65, or you're pregnant, or you have any long-term conditions, or you've had chemotherapy recently, or for instance, are on steroids, you should be getting in contact with a GP or 111. And of course, if you have symptoms I mentioned before, if you do actually get if you're coughing up blood, if you're getting chest pains or difficulty breathing, you should be getting in contact with a GP or calling 111. That's perfectly appropriate to do that and the right thing to do. So going on to COVID, coronavirus down there, it's also important to be mindful about COVID. Whether or not you have some super duper variant, there's still a lot of COVID around. And of course, we're not testing it, so it's difficult to know just how common it is at any one particular point, but the suggestion is the numbers may be going up. And we've all had experience, but just remember there's a whole range of symptoms you can get with COVID, and we do refer to them in the fact sheet. And remember the issue, you can get that continuous cough, and you can particularly lose your sense of smell. Now, once again, it's terribly important that if you're actually eligible for a coronavirus test, treatment or vaccination, that you go ahead and get it. It is very likely that if you're already eligible, that the NHS will already have got in contact with you. But if you're not sure, we actually put a link in the fact sheet itself, and you can check whether you're on that list of people that are eligible, and if you are, go ahead, contact your practice and get it done. So if you think you have COVID, you should be staying at home only if you have a high temperature or don't feel well enough to work or carry out your normal activities. But otherwise, it's safe to be up and about, and you'll notice that is different to what was actually said during the actual epidemic, where it was actually far more important that people didn't get in contact with anybody else. And you remember all the advice which still applies within your home: hands, face, and space. So if you're feeling particularly unwell or unable to manage, or if you're worried about a child, again, particularly under the age of two years, you do need to get in contact with your GPs. And if they're closed, you need to ring 111. So finally, we come on to norovirus. This is the only one that's not really a respiratory problem. It's often called the winter vomiting bug, but if you had it, it is ghastly. And although it's called the winter vomiting bug, the diarrhea that you can get can be pretty horrid as well. You can get a slight fever with it, and you get headaches, stomach cramps, and aching limbs. So it can make you feel generally unwell, and it doesn't feel like a minor illness generally. So, but although norovirus is not dangerous usually for most people, it is very, very catching. So if you've got it, you should stay at home and rest. Again, drink plenty of fluids, perhaps more so because you need to replace what you're losing, even if some of it appears to be coming back again. Now, you can take paracetamol if you're having a temperature or aches and pains as well. If you think you're losing a lot of fluids and you're feeling unwell, you might want to speak to your pharmacy about getting medication to help ease your symptoms and to replace the fluids better. But if you get blood in your diarrhea and your symptoms haven't improved after a few days, or if you have a serious underlying health condition, then you should actually be getting in contact either with your GP or via 111. So now there are other self-care forum fact sheets covering a lot of the conditions people are likely to experience during winter. That includes sore throat, cough, fever in children, common cold, sinusitis, and strep A. These fact sheets are there to inform you and empower you and inspire you to actually look after yourself, but also know when it is you should be seeking help. Now, on the fact sheet itself, there's another section we haven't put up here, which is where to get the extra advice. And we particularly recommend you look at the NHS website, which is excellent. But if you have this fact sheet handy, this winter illness fact sheet handy, you'll be able to deal with most of the common conditions and get a good idea of which of these you might actually have, and how to deal with them effectively yourself and for your family and those you care for. Now, I hope you found this helpful. I'd like to now hand you over to my very good friend, Trevor Gore, who has some wonderful insights into why we do what we do and why we don't always do what we should do. So over to you, Trevor.
Thank you very much, Peter, and huge kudos to you for your dedication to the Self-Care Forum by catching a winter illness when you were having to talk about them. I think over and above what was needed. Next slide, please, Helen. One of the challenges we face in healthcare is most healthcare treatments, most healthcare processes are based on the fact that we're all logical creatures, we'll all do the right thing all of the time. And it's not true. And this book turned me on to it. I put the new in inverted commas because this is well over 10 years old now. And the great thing about Daniel Kahneman was he won the Nobel Prize for economics. But he's a psychologist, he's not an economist. And he worked out that people don't actually behave as logic would suggest they would. Next slide, please, Helen. Helen mentioned earlier that you know, for every 10 hours somebody spends with a professional healthcare worker, they probably use 8,750 hours of self-care. That's similar to, in a working week, in a week 168 hours is about 15 minutes a week. So that's, you know, the vast majority of care takes place outside of healthcare. And behavioral economics seeks to look at what people do when we're not with them, when we're not helping them. Next slide, please, Helen. I've highlighted the highly predictable ways. People do not do what we think they're going to do, but they're highly predictable in the ways that they veer from common sense. Words are really important. Peter mentioned we don't like talking about minor ailments because the brain is what Daniel Kahneman discovered in Thinking Fast, Thinking Slow is the brain is actually quite lazy and just looks for fast, simple solutions to all its problems and takes shortcuts all the time. So when you hear the word minor, it means of little import. It's not really, versus common, which means everybody else gets it. And you know, a great example is, would you fly on a cheap airline or would you fly in a value airline? And the brain immediately makes these connections. Cheap means it's not been put together well. Value means that they're saving money, but they have really different meanings. And across healthcare and across behavior, there's over 100 biases of the way the brain shortcuts things that might not be helpful. Next slide, please, Helen. So this it's referred to as the action intention gap. We all intend to do the right thing if we know what the right thing is, but we don't often do it. I'm a type 2 diabetic, and I will eat sensibly and cut down my sugars and do my exercise and all that, and then I'll go to McDonald's. And I'm not alone. And we all do this. We know what's the right thing. You know, should I go out for a jog this morning? Oh, it looks a bit chilly. No, I'll sit inside and do something that's comfortable, or I'll maybe do it later. It's why we have a pensions crisis in the country, because the action is, yes, I'll put money into a pension, but not now. Surely I'll do it later on, and then suddenly you haven't got enough time to do it. So we're very good at putting off the inevitable, and especially so in healthcare. I'll look after that a little later on. Next slide, please, Helen. The best medicine is the individual who's informed, empowered, and inspired. And that's what we in the Self-Care Forum try to do. Give people the information, but empower them and inspire them to use it. I use an acronym. I'm very good at acronyms. KUBA, K-U-B-A. And the K stands for knowledge. So do people know what they should do? Then the U stands for, do they understand what they should do? Because knowledge and understanding are very different. And then, do they believe what you've told them is relevant to them? And finally, the A stands for, do they act? And for me as a behaviorist, knowledge and understanding, great, it's the foundation of behavior, but the behavior and action is actually more important. Because if you believe, I mean, ask any smoker in the world, do you know and understand that smoking is bad for you? They all do. Do you believe it? And some won't. Some will say, well, not for me because I'm ultra healthy. They're not doing the action. They're not stopping smoking. So we need knowledge, understanding, behavior, and action. So it's empowerment and inspiring people to do the right thing. Next slide, please, Helen. There's a lot of research done on why people don't change behaviors that aren't working for them. And number one is lazy, not as in slouching off, but as in, you haven't given me enough reason to change. You know, I'm not inspired to change. It's I'm happy with the status quo. I'm happy with what I've got. The next is confusion. There's just so much information out there, and we learnt, to many of us to our cost during COVID, that a lot of the information out there is not true. You know, thank you, Donald Trump. But you know, injecting yourself with Dettol, not a good way. So a lot of confusion. There's a lot of bad information out there. You know, I was talking to a doctor yesterday, and he said 80% of patients now who come to see him have looked up their symptoms on Dr. Google and have made a diagnosis, most of which aren't right. but this is how we behave. And finally, they're scared. You know, oh, what happens if I take this and it doesn't work? Or what happens if my condition gets worse? Next slide, please, Helen. The confused one's really interesting. So there's another area of psychology that looks at choice and how we make choices, and it's called the paradox of choice. And the common held belief is that the more choice you give people, the easier it is for them to make a decision. The truth is the reverse. The less choice you give people, the easier it is. I mean, picture yourself going into your local supermarket. Look at the toothpaste section. It's a wall of thousands of different products. And I know what you buy. You buy the one you bought last time or the one that's on a special offer, because the brain is lazy. It looks at these thousands, tartar control, whitening, gum, tongue, and it just thinks, eek. What did I have last time? That seemed to work, or that's on offer, I'll do that. You go into a restaurant, and if it's a 15-page wine list, you'll buy the one you had last time, or the second cheapest, actually, is usually the way. Next build, please, Helen. This is a cracking study that shows that. So the people would allow 24 choices of jam or 6 choices of jam. And the one with more choices attracted more shoppers, and I'd expect that. However, the number that sampled them stayed about the same. And the next build, Helen, please. Yet the one with the smallest choices of jam had 10 times as many people who actually bought jam than the ones who just looked. And that's because the brain is lazy. You know, oh, 24 choices. Do I want apricot? Do I want this, that, and the other? Or 6 choices. Yeah, I want the strawberry. So quite often, and Peter explained it very well on our fact sheets, we give a limited number of choices. There's far more that could have gone on them, but it's just a really short, limited number of choices that will help the majority of people. Next slide, please, Helen. Context matters. How you talk to people, where you talk to people, and when you talk to people really matters in their healthcare. So I hope most of you there see the letters A, B, C. Next, please, Helen. I hope most of you there see the numbers 12, 13, and 14. And the final bit. Yet the middle number was exactly the same. It's a B or a 13, depending on what's going on around you. And healthcare's like that. You're in a doctor's surgery and he gives you a lot of information, probably quite quickly, and then asks a question that's incredibly stupid. Do you understand? Who sits there and says, no, I'm a little bit stupid, I don't understand? Do you understand is what's called a closed question, and it should rarely be used. The question should be, what is your understanding? How would you take this to help people to check? But when people are in healthcare settings, quite often healthcare professionals are sort of put on a pedestal, and they're right, and we'll just follow what they say and do what they say. So the context of how we behave in a healthcare setting is very different from how we behave at home. And there's something known as white coat syndrome. Your blood pressure is higher when it's taken by a doctor than it would be normally, because the fear of a man in a white coat puts your blood pressure up. Next slide, please, Helen. These are the traditional methods of motivating people to do something. It's carrot or stick. The problem is neither of them work particularly well. If you give somebody a carrot, the second you stop bribing them or giving them rewards, they stop doing the behavior you want. And if you're beating them with a stick, the second the beating stop, so does the behavior you want. And that's why I said inspired and informed is the way to go. Excuse me, because people want to do the behavior. They're not being forced into doing the behavior. Helen, next slide, please. I mentioned earlier, words are really important, but also how we phrase, how we put people's options in front of them. So if you told somebody they will gain 5 years of life quitting smoking, or you said you will lose 5 years of life by smoking, do you think they'd have the same effect or different effects? Next slide, please. It's actually called the loss aversion bias. As a species, we don't like losing what we've already got, and that includes health. It's not about getting fitter. It's, if you ask people what they define as wellness, it's not being ill. It's not looking for other things. So if you tell people they will lose 5 years of life by smoking, that's about 3 times more powerful than telling them to stop smoking because they'll gain, because you can't predict or put into your mind what an extra 5 years of life would look like, because it's the future. You have no way of planning the future. You know exactly, can we go back to, please, Helen? Thank you. You know exactly what 5 years of life you've already got looks like because you've had it. So losing it is more worrisome. It's like losing a £5 note is more worrying to you than finding a £5 note, because you didn't have the £5 note anyway, or 20 now. It's Peter offering it you with flu. Next slide, please. Politicians know that. The very divisive Brexit campaign didn't talk about let's get control. It was let's take back control. That's a loss aversion framing. It's you don't want to lose something you've already had. And the brain likes that. The brain, oh, I don't want to lose things I've already got. Next slide, please, Helen. The other thing is how we sell things is really important. The use of words, things that sound exactly the same aren't, because the brain is lazy and it finds the quick way. So would you buy an 80% fat-free yogurt or a yogurt with 20% fat? They're the same thing, but nobody markets a yogurt that says 20% fat. They all market it as it's 80% fat-free, because the brain likes that. It fits into, I don't want to eat fat. That's really good. During COVID, there was a marked difference between people who were told to stay at home versus people who were told you'll be safe at home. People who were told they'd be safe at home were less. And I've worked with a number of large pharmacy chains. I've told them, don't put out of stock. We know the NHS is suffering at the moment, but don't put out of stock, because out of stock, the brain interprets as saying, you're not a very good shopkeeper, you didn't order enough. Whereas if you put sold out, the brain says, oh, this is quite popular, lots of people bought it, I probably want some. So really simple things that sound like the same thing make a huge difference in the way the brain perceives it. And one of the probably greatest marketing companies in the world is Apple, and they started with the iPod, and there's all the things it did, but they actually just said it's 1,000 songs in your pocket, and that tells you exactly what you want to know. It wasn't about its megabytes or its interfaces or anything else. It's 1,000 songs in your pocket. Next slide, please, Helen. Thank you. Metaphors is a developing area of science, and it's where we again tap into the brain liking for things it knows and laziness. So we use metaphors to describe medical issues. First couple, please, Helen. We'll do the first two. So, you know, hemoglobin, can be quite difficult to explain the purpose of hemoglobin. So it's likened to a school bus that drops off and picks up children, and hemoglobin is dropping off and picking up oxygen. And your prostate, for men of a certain age, it's, you know, likened to standing on a hose, and it restricts the flow. Next two, please, Helen. Fiber, it's a sponge. So, you know, health literacy is a real problem in healthcare, and finding ways to explain that people understand and take on board and can act on is really interesting. The depression one I love, because everybody refers to depression as like being in a black hole or a dark hole, but it explains that the medication is the ladder that gets you out of the black hole. And suddenly people can, because we know people with depression stop taking their medicine quite frequently, but if they understand that that's what's going to help you out of the black hole, it's really powerful. Next one, please, Helen. We all love the NHS, and we know it's got challenges, but if people understand what effect their choices have on the NHS, so we talked, you know, we're talking about cold and flu and a blocked nose. If you treat yourself, whether you go to the pharmacy or go to the supermarket and buy decongestant, it'll cost about £3.99. If you go to the GP and he writes you a prescription and you go to the pharmacist, that costs the NHS about 35 quid. If you go to a walk-in centre, it's £43, and if you go to A&E, it's £66. And just this morning on the news, there were talks about something like only 20, probably less % of people should be in A&E. They should have been treated in pharmacy or called 111 or find other ways of looking after their health. So letting people understand the effect their choices make is really powerful. And I think my last slide, Helen. 3 things I certainly can learn from this picture. It is America, but you'll see the same behaviours in the UK. And they're going up an escalator to go to the gym. The behaviour I see in the UK, because we don't have escalators outside, is people driving around a gym car park 5 times until they can park near to the door of the gym. And the 3 things I learned from that is, 1, we are illogical creatures. But the second one is we have a real propensity to segment behaviours in our head. We can compartmentalize. So it's the same as when I go to McDonald's, I do order the Big Mac, I do order the large fries, but I compartmentalize and order a Diet Coke. So I'm doing my bit, I'm doing all right. And then the third thing we learn from this is we're pack animals. If we see somebody doing a behavior, we're quite likely to follow that behavior. That's me done. Back over to Helen. I hope you found that interesting.
Thank you so much, Trev. I always never get tired of hearing you talk about this. It's a fascinating subject, and I really do hope that other colleagues on the call have found it useful as well. I'm sure you have. We have got a little bit of time for questions. I don't think there are any questions in the chat, but I'll just leave it up there just to summarise. What hopefully you will have taken from this is to have a better understanding of what is meant by self-care, and also to be able to appreciate why it's important to the wider health and care system, be able to identify some of the more common ailments and how long they might normally last, and know when to seek help, but also where to seek advice. So, making sure that we do, as Addy says, use our pharmacists and other services, and maybe able to consider, after listening to Trev, what makes us do the things that we do. So as a final call for us as the Self-Care Forum, these are some of our sort of like go home messages, if you like. We want you to please share our fact sheets, help us in promoting Self-Care Week. So as I said, it's the middle of November. So this year, the dates are from Monday the 13th through to Friday the 19th of November. We will be having a Self-Care Week Twitter chat. Not sure we're still supposed to call it Twitter, but we are. And that is on Monday the 13th at 12 o'clock. So please do join us for that. We will be announcing our Self-Care Innovation Awards for 2023. But join enter for 2024. Even if you want to become one of our champions, please do contact Libby Whitaker. Her email is on the bottom of this slide. And follow us on X, Facebook, LinkedIn, and if you want to subscribe to our newsletter, again, contact Libby and she will add you to the newsletter email and mailing list, and look at our website. All of our fact sheets are available on the website, as well as quite a lot of the research that we've just touched on. So lots of other information there for us. And finally, please do complete that survey that I mentioned. It's really important to us for this particular piece of work in understanding self-care. So I haven't got any questions. I'm going to stop sharing. It might be easier if people can see everybody rather than the slides. If people are having trouble, then please do put your hand up and we can hopefully. Got lots of thank yous and interesting and engaging. So that's really, really great. Maybe we've answered all your questions. So I'm taking it that we haven't got any questions, colleagues. So I'm just going to leave it as please do get in touch with us. Contact us. Contact Libby is on the slides. We will be sending out the slides to everybody who has attended. And a final reminder to complete those evaluation forms for us. Really important that we just get a sense of what people are learning from this webinar, which is a part and parcel of our overall strategy for improving health literacy, our little part of it. So thank you.
Fantastic. Thank you very much, Helen. And thank you to all of our speakers today.
Have a nice day, everybody.
Thanks, Pete. Thank you.
Thank
you. We've got claps from Deborah, which is lovely. Thank you, Deborah. I know Pete has got to go, but it is nearly 1 o'clock, isn't it? So
1 minute off.
So
1 minute off.
I will end the recording now. Obviously, for any guests that are still here, you're welcome to ask questions for the next couple of minutes, but do feel free to log out and make sure to fill in that survey. Thank you very much.